This scribe will discuss the use of antiseptics in surgery and their contribution to resistance. Antiseptics are a cornerstone of infection prevention in veterinary surgery. They are applied to the surgical field, to the hands, and to equipment to reduce microbial load and lower the incidence of surgical site infections, also known as SSIs. However, repeated or inappropriate exposure to antiseptics exerts selective pressure on microorganisms. This can lead to reduced susceptibility, especially in organisms frequently exposed in the hospital or clinical environments. Bacterial adaptations that result in reduced susceptibility include efflux pumps that expel antiseptic molecules, alterations in cell wall permeability that reduce uptake, and biofilm formation, which provides a physical and metabolic barrier. These mechanisms can also contribute to cross-resistance against certain antibiotics. In clinical settings, contamination of antiseptics during use or the use of sublethal concentration of antiseptics may foster survival of resistant organisms. In addition, overuse of antiseptic dressings and rinses where cleaning or debridement would suffice also adds unnecessary pressure. And finally, some pathogens, for example, Staphylococcus aureus and Pseudomonas species, demonstrate tolerance development in clinical settings. Best stewardship practice for the use of antiseptics includes applying antiseptics for only evidence-based indications. For example, preoperative skin preparation, surgical hand antisepsis, or field disinfection. We should remember the toilet bowl analogy, that is, you have to remove the dirt before you can hope to disinfect. We also need to adhere strictly to validated concentrations and contact times. Higher concentrations are not more effective and do increase the risk of resistance. And finally, avoid routine or prolonged antiseptic application where it is not supported by the guidelines. Prudent use of antiseptics is part of antimicrobial stewardship. Indiscriminate application undermines infection control, reduces the effectiveness of our limited antiseptic armamentarium, and contributes to the wider problem of antimicrobial resistance.